Thank you, Mr. Nicholson. Thank you for your declaration. And now I would like to open the floor for a question and answer. And would like to start with Madame Demov. You have the floor for 7 minutes, please.
Thank you so much, Chair. Thank you to all of our witnesses for being here today. Dr. Nicholson, it's so nice to see you again. And I want to thank you for the work that you're doing around the world. It's so meaningful and impactful. You mentioned climate change. I'm wondering, would you be able to talk just briefly on how that's impacting what you're seeing in around the world?
Sure. So we think of climate change in many of these crises as a crisis multiplier, and so we're trying to understand and untangle, exactly what this means. But in our projects, there's in some instances very clear medical impacts that climate change is having. So, for example, changing patterns of disease. So in some instances, diseases such as malaria that have a seasonal routine or pattern to them. We're seeing peaks of malaria that are more intense. We're seeing seasonal malaria cases arriving at different times and so on. So climate change, from a medical perspective, in some instances, is changing the patterns of disease and making it more unpredictable. From the perspective of forced migration, I mean, what we do hear from people, in particular people who are dependent on agriculture for livelihoods and so on. If soil becomes unusable, right? I mean, this becomes a bit of a complex integration of multiple things, right? If somebody is dependent on, a climate-sensitive industry for economic viability and they're living in a conflict setting and so on, right? This is multiplying the level of stressors that a person is facing. And so we are hearing in our projects more and more that people are saying that climate is impacting their ability to have, a basic livelihood, and is one of the factors that is contributing to a decision to flee. But that's often layered on top of underlying violence, conflict, and other things as well.
And I guess once they've already fled, it would also cause, I'm thinking of the Rohingya in particular with flooding, so you're in a refugee camp, you hardly have the capacity to deal with flooding, which would in turn lead to more disease in that camp, I would suspect.
Yeah, absolutely. I mean, again, I'm a public health specialist. At the moment, we're responding around the world to more outbreaks of cholera than at any other moment in time. I mean, there's a global stockpile of cholera vaccines that's been depleted for more than 2 years. Some of that is due to market conditions, but it's also largely due to the fact that we're simply seeing more cholera. That's not all entirely dependent on climate change, but some of it certainly is. And so, this is a certain reality that as climate is having an impact, particularly on infectious diseases, when we have outbreaks that occur on top of a refugee crisis or a forced displacement crisis or so on, we're going to run into a lot of different crises that are converging all in one place.
MSF has used the language of a protection gap and then the emergence of the term survival migration. Can you maybe speak to us and explain what that is?
So we're not a protection organization, so I don't think that we're necessarily the best place to fully comment on the protection gaps necessarily. We see this in our medical programs. I mean, the statistics that I mentioned before around more than 20,000 survivors of sexual violence in our clinics. This is how protection gaps present in MSF programming. This is what we see. We see people who are victimized, people who have been assaulted and injured and who are in need of medical care as a result of the failure of protection systems to adequately protect them.
The previous witness, I don't know if you heard her talk from Oxfam, was talking about the increasing impact on women. My colleague also mentioned that. Are you seeing in the people that you're dealing with a change in demographics in who is fleeing?
I think I want to be cautious about making general assumptions about hundreds of millions of people, because every crisis is quite different. The conditions that lead somebody to flee are going to be quite different, and so on. We consistently see that women and children are among the most vulnerable in any humanitarian crisis around the world. However, I think we also need to recognize that gender plays a significant role in these crises, and in some instances we see men, for example, who might be specifically targeted because they are men. But the result of that is that we see more women in our programming who are fleeing and who are in need of medical care. But the short answer is yes. I mean, these vulnerabilities are very real. This is why, as from a public health perspective and somebody who's worked in doing needs assessments and so on, it's very important to understand, who is standing in line at the clinic, and, is there a significant gender disparity in there, and why does that exist, and so on, and, making sure that programs are adequately identifying people who are most vulnerable and most in need and targeting specific strategies to reach them.
I was in Costa Rica this summer and went to a migrant shelter. And one of the things that I learned when I was there is they're seeing more families. Part of these, it used to be just men that were fleeing. It's now whole families. And the impact on long-term mental health impact on those kids. I mean, are you seeing that in your work? I recognize that every country is different, and I don't know if you're working in Central America or not.
Programming throughout Central America. The other witness has been an expert in protection issues and maybe has something to add. But I mean, certainly we're providing quite comprehensive primary health care. We're seeing a huge need for people to, receive quite basic primary health care as they're fleeing whatever situation of violence. We're seeing massive mental health needs. People have been exposed to very high levels of violence. To your point, yes, certainly it's families, it's women, it's children. We see a full sort of family unit in many of these programs.
Now, Mr. Nicholson, in your opening remarks, you targeted three crises, Sudan, Democratic Republic of Congo, and the Rohingyas. I'm not an expert, you are. However, I get the sense that those three conflicts don't necessarily have that much in common. Now, from a Canadian standpoint, what about the funding of humanitarian aid? The UN has been calling on Canada for years to contribute a higher amount of the GDP in humanitarian assistance. I think we're at 0.9 of 1%. We're lower than Stephen Harper's levels. The Liberals said that they were going to increase those levels, and yet we're under Stephen Harper's threshold in terms of a GDP contribution. Does that affect your role on the ground at MSF?
Je vais te répondre en anglais.
I'll respond in English.
Okay, so there's a few points to make here. The first is that I think we've heard several times today that humanitarian needs are extraordinarily high. I believe the UN estimate is that there's 300 million people who are in need of life-saving humanitarian assistance and who are covered by a humanitarian response plan. So the impact that this has on Médecins Sans Frontières is in a number of different ways. The first is that we are responding to a very large number of humanitarian crises in roughly 70 different countries. I mean, we did 16.5 million outpatient consultations in our programs last year. So the needs are very, very high. On the humanitarian funding question specifically, I want to emphasize that we're a largely privately funded humanitarian organization. Canada is, in fact, one of only 3 government donors that we apply for funding from. So we're largely privately funded, which allows us to respond very quickly when emergencies happen. But the fact of the matter is that the humanitarian system is stretched. I mean, there are huge needs that are going completely unmet. Some of that is an efficiency problem and other things. But some of it, very honestly, is simply a lack of funding. In the Rohingya crisis, for example, World Food Program rations are down to $10 per person per month. This is simply a funding shortfall in many of the crises around the world.
Oui, c'est effrayant, en effet, lorsque vous nous donnez ces chiffres-là. Je suis content que les analystes prennent ça en note. Vous avez aussi parlé du rôle du Canada. Vous avez dit, là, je vous cite de ce que vous avez dit, le Canada a échoué dans les dernières années par rapport à son rôle de leader.
Has failed in its leadership role. Now, we're talking about humanitarian aid, peace building, human rights. Now, those three crises have something in common. Personally speaking, I haven't seen Canada taken the necessary action to have a very credible voice on the world stage in those three specific countries.
Start with the Rohingya crisis because I actually think that this is a very good example of a crisis where Canada stood up and showed significant leadership. Canada in 2017, at the outset of this crisis, appointed Bob Rae as the special envoy on the Rohingya crisis. There was a report that was generated, there was recommendations, and so on. This was significant not only because of those actions, but because the political capital that it mobilized at a high level, I think, empowered Canada to take action at country level in Bangladesh, where there was actually quite a bit of significant advocacy that happened on behalf of the humanitarian response and on behalf of the Rohingya people. And that, permeated into other countries as well. There was actually a lot of very, very good work that happened under Canada's Rohingya strategy. And unfortunately, that wasn't specifically renewed in the budget. We think that it should have been, and that work needs to continue. Now, I mention it because I actually think that it's a very helpful reminder that Canada can take on some of these crises and show significant leadership. I'm not saying that a special envoy is always going to be the solution and so on, but having high-level political endorsement of a Canadian response that mobilizes, yes, humanitarian funding, but also Canada's diplomatic efforts and humanitarian advocacy and humanitarian policy and so on can be very effective when all of these resources are put to work in response to a crisis. But simply funding the humanitarian response is not enough to actually address the underlying problems that create it, or the myriad of problems that come along, as organizations are trying to respond and negotiate access and so on, particularly in violent conflicts.
Le troisième élément.
Now, the third thing, I think I still have some time left. The third thing, and again, I'm not an expert, you're the expert, but there is perhaps a common link between these three countries. I spoke about funding and Canada's leadership role or lack thereof, but there's also the issue of mediation. Now, folks here in Canada and Quebec, I go to Lac Saint-Jean each and every week. There's a lack of media coverage. And people have their everyday affairs to go about and economic issues, social issues, but this is one of the worst humanitarian crises worldwide, and we just don't hear much about it. Perhaps that's not the Government of Canada's role. Perhaps there's an issue with a lack of media coverage, or perhaps politicians are falling short in some way in terms of not bringing these issues to the table and bringing them to the media's attention. Perhaps I'm completely off base with my analysis.
It's very challenging to draw attention to neglected crises. I mean, we talk about what we see in DRC, in the Rohingya camps, in Bangladesh, in Myanmar, in Sudan, in Chad, in South Sudan, and so on. It's very difficult to get media attention.
Rapidement, parce que je sais que je vais vous prendre.
Very quickly, I know I don't have much time left, but now, crises like Ukraine, the Gaza Strip, we hear about each and every day. Do they overshadow what the crises you've referred to?
I think yes, but the needs are also very high in these crises. But just quickly on your second point, it's absolutely essential that members of Parliament are speaking about the neglected crises and trying to find a useful role for Canada in responding to these crises. So yes, I think we as humanitarian organizations have a responsibility to try and push this into the public dialogue and into the media and so on. But parliamentarians as well have a very clear responsibility to be talking about it, whether it's at committee or in statements in Parliament or somewhere else.
Dr. Nickerson, maybe you can speak speak about the mental health impacts of forced displacement on populations like children, and who are obviously more vulnerable to those impacts. And maybe you can also add about how difficult it is for displaced persons to access trauma-informed mental health care.
Sure. So mental health programming has really become a core aspect of our humanitarian medical response. I mean, you know, when you're inside of a high-intensity armed conflict, people are exposed to a tremendous level of violence. It's unpredictable. It's often indiscriminate. You know, people are exposed to very high levels of psychological stress, and they're in need of mental health assistance and support. There continues to be huge gaps in this kind of programming, and I would also say as well for more severe mental health disorders and psychiatric conditions, there's almost little to no aspect of that's included in many humanitarian responses. So there's a very significant need. In terms of trauma-informed responses, I mean, this is exactly how we're implementing, you know, a package of psychosocial care. And I would say that, you know, it is a really important aspect that I think needs to be considered. Like, we're a medical humanitarian organization. We integrate these things into our programming, and particularly for a service package such as sexual and gender-based violence care, you know, there's the medical response, there's the psychosocial response, which we provide as a comprehensive package, but then people also continue to need access to legal assistance, they need housing, they need shelter, they need protection, and so on. And so, you know, I think that there's really a need to consider the full sort of suite of services that people need in these kinds of acute humanitarian crises.